The colon, that muscle, pushes food on down, and when you're ready, the steel door down here, the trap door, which is the sphincter, the rectum, will open up, excrement will pass out. Now, this sphincter is really strong. In fact, it's a muscle that has to be able to hold in liquid. Sometimes you'll have liquid dominant species, and you have to have an airtight sphincter that won't allow liquid to come through. So it has to be strong. It has to be strong for several hours. So and that's what this sphincter is so good at. It's good at detecting and determining whether the stuff that's in the colon is solid, liquid, or gas. If the sphincter didn't know that, you would want to pass gas thinking you had gas, and you'd let actually stool through, or you'd let liquid through. Young people talk about sharding, and that's thinking that you're passing gas, opening the sphincter up, but allowing contents of poop or liquid to come on through, and you have your accident. That doesn't usually happen. As you get older, it can happen because the sphincter becomes thinner, and it can't tell as well whether it's liquid, solid, or gas, so it can happen. Or in diseases like a pinched nerve, damage to the nerves of the lumbar spine that control this area, you can have accidents because the nerves don't work right, and the nerves control the muscle. So again, if you were to have to stand on your tiptoes for a long amount of time, the calves would give out after a while or cramp up. Same thing with the sphincter. If the sphincter has to constantly hold very tightly because it is trying to keep in what wants to come out, and or you can't find a bathroom, it's going to actually cramp up after a while. And sometimes it'll cramp up to the point of having great pain in the rectum. Now, when that happens, it becomes a one-time event. If it becomes long-term and frequent event, then you'll actually have the brain tell the rectum, oh, better spasm up again, and then you'll have psychology involved, and you'll start to have pain and apprehension and spasm without even having contents of food around. That gets into a psychological problem, but some people that go through that will say that they feel like a knife is being stuck up their butt. That's because the cramp is so vicious. For the sake of our talk today, we're just going to talk about hemorrhoids. And hemorrhoids hemorrhoids are blood vessels, and blood vessels will follow the nerves. So because of any muscle needing blood supply, you have to have a blood vessel or two pass to this area of sphincter. So the sphincter is actually circling, the muscles circle like this. When the sphincter is tight, muscle grabs. When the sphincter is loose, muscle opens. To have that muscle do that, you have to have a lot of blood flow, because it has to sustain that sphincter being so tight. Now the blood flow, usually the blood vessels come from the plexus of the colon. The colon supplies a little bit of the blood vessel, and then the outside glutes and the anus also supply the blood vessels. And they give blood flow and oxygen to the muscle that's working all day long, and you're good. And the blood vessels are usually kind of on the tiny side. The problem is, if you get into this bad habit of pooping or irritability going between constipation and diarrhea, when you have the sphincter that says tighten up, and then you have the sphincter that says no, loosen, you're going to have some problems. And that usually comes from a bad diet or a lot of unanswered stress. So when the sphincter has to constantly tighten, but then at the same time in a millisecond you have to go poop, and you're in a hurry to poop, and you force the sphincter to open, it doesn't always cooperate. The muscle and the blood vessels will get a little irritated. And what happens is the blood vessels actually become very large. When the blood vessels become large, they'll sometimes start to encroach on the lining. If the blood vessels get too big, kind of like a guy that's powerlifting, you'll see his neck veins pop out. I've seen it on a couple of my videos when I talk on my videos. Well, the blood vessels down in the rectal area can also pop out. And the thing is, when you see somebody that gets angry, is lifting a powerlifting, if you see somebody going through powerlifting, you'll see their blood vessels pop out. But when they're finished with the powerlifting move and the big force, the Valsalva maneuver, the blood vessels will go flat again. The problem with the rectum is that usually that sphincter stays tight for a long time, It constantly has to hold back on excrement that wants to leave. That means the colon wants this stuff to leave, but the sphincter says, no, I'm not ready. You'll have this thing holding tighter and tighter and tighter against the pressure that's building up here. And you'll have blood vessels that'll stay enlarged. Again, blood vessels to the rectum, they'll stay enlarged. When they stay enlarged, they'll start to accumulate blood down in this area. And if they stay large, accumulate blood in the area, then they'll start to push out. If you've ever seen an older man or woman with a little bit of a weight issue, you'll notice they'll have varicose veins. Varicose veins are when the veins get really big and they don't go back down in size. Same thing happens with the rectum. Except there's no room in this area. In the legs, you have varicose veins that can push out because it's skin and there's nothing else underneath except for muscle. Here, there's no space for anything. So what happens is, first, your hemorrhoid vein will push out into the air in the lumen or the anus. Now, if it gets to be big enough, then you involve more and more blood vessels. Then you'll have the hemorrhoid vein push out into the anus externally. That's when you can feel or see these things pop out when you force poops through. So usually, right about here, you'll have nerve endings that take care of anything on the outside. So any kind of external hemorrhoids will be very painful as they pop out. And as excrement passes through here very fast, it might rupture one of these blood vessels and you'll have bleeding. Bleeding, pain. People have described it as passing a hot cannonball through their rectum because of how sensitive the blood vessels are. If you have blood vessels that are towards the inside, then usually there's no nerve endings in this side of the line and they'll be pain-free. So sometimes if you have, like I'll do it on this side, a blood vessel that pops out here but is only attached up here, it'll actually come out here but it won't be painful. You'll have people say that they had to push their hemorrhoids back in. And so that's pretty much the makeup of an external and an internal hemorrhoid. When you have, and again, sometimes the rules will bend, but you can usually narrow it down to that. It'll either be an internal hemorrhoid or an external hemorrhoid. So they'll either be that, where the hemorrhoid is nothing but a blood vessel, or you'll have this, where the hemorrhoid is a prolapse from the inside. These guys are painful. These guys are not. And you can usually push the internal hemorrhoids back in. The external hemorrhoids, they stay open. Usually those external hemorrhoids, if the blood is blue enough or is painful enough, what the docs in the emergency room or immediate care center do is we actually have to put a nick through that, allow the blood clot to leave, and it actually feels a lot better. If you allow the blood clot to leave, it just becomes a hollow space and it shrinks in time. But it is an open cut. So you'll have to take care of that empty hemorrhoid and the cut with soaking in SIDS baths, using steroid creams, and then not bearing down too hard, and then getting on a mostly bananas, rice, and applesauce, a low residue diet, so that you don't have to have excrement pass through while you're healing up for a day or two. That brings me to my next thing is, when you have these hemorrhoids, whether internal or external, sometimes what we'll suggest is to use steroids. So let's just say you have an external hemorrhoid over here or an internal hemorrhoid right here. Wherever the hemorrhoid is, we can usually use steroids on the outside in tube form. You apply to the outside, and it will work like a rash on the skin anywhere else. If you apply enough steroid to the rash, it calms down the irritation. If you apply enough steroid to the outside, it'll calm down the hemorrhoid, as long as you're taking it easy with the food that's going through. So if you're taking it easy and not If you hold off on any further food and make it low residue so there's hardly any excrement, then you can allow the creams to work. Occasionally you have to poop and clean off the area, but you have to reapply the cream. It's usually a 3-time-a-day steroid. After about 2 or 3 days, as long as you follow the rules regarding the eating pattern, it heals the hemorrhoid up and it shrinks. Sometimes if you have an internal hemorrhoid, you'll actually have to use a suppository on the inside. Sticking a suppository on the inside, and you can follow the instructions from the pharmacist. You put steroid on the inside, it actually melts because of the temperature inside the anal and rectal cavity, and it bathes the hemorrhoid on the inside. It does leak out a little bit on the outside, but for external hemorrhoids it's better to apply cream or ointment. Internal hemorrhoids, better to use steroids in suppository form. Sometimes you can use foam by inserting the tube. These things come with small tubes. You can put the tube inside the anus, squeeze a certain amount in, and it'll put the cream on the inside. I feel that most of my patients say that's more painful than just using the suppository. In Eastern medicine, there are ways to use acupuncture to shrink hemorrhoids. And in energy medicine, hemorrhoids are said to be when the body and mind will not let go of unnecessary things. So sometimes it's nice to let go of things and the hemorrhoids don't come back. But it is all a matter of bowel function. The one caveat is sometimes, because you can get an infection to some of these. In 20 years I did have somebody come in and he had an abscess. So the hemorrhoid got infected because it was cut open, and the bacteria on the bottom, remember there's a lot of bacteria in the colon, hopefully more good bacteria than bad bacteria. There's also bacteria on the outside. The good bacteria on the inside is fine. The bad bacteria on the outside, when it gets through a cut or a break in the skin, it can actually get an abscess to this area, and the abscess will travel this way. So that has to be, it's hard to see, and usually have to get a CT scan to figure it out. Persistent pain that does not go away with steroids, does not go away with changing your diet, and then once you get a CT scan you see a big abscess that has to be cut open by a surgeon. Very painful. I've only had one in 20 years, and we thought he was more of a hemorrhoid, but because the pain did not go away, we sent him to the GI specialist, and the GI specialist said it's an abscess. Plus blood tests became positive at that point. So those are the basic premises for our hemorrhoids. Again, usually if you want to avoid these things, if you have a good pattern with what you eat and how you poop, what you eat, how you poop, what you eat, how you poop, it's got to be repetitive. So if you stay with a high fiber diet, things will go through easily. So it is very important to practice good hygiene as far as things to take care of the anus or outside. Also good eating hygiene as far as whole food, mostly plant-based diet with fiber. Those of you who watch my fiber videos, I always suggest 25 grams for women of a combination of soluble and insoluble fiber, and about 35 grams for men. And that's at the minimum. If you have problems with high cholesterol, then it should be even higher. You have to have some form of fiber. I like whole grains, but you can get it in legumes, beans, vegetables, fruits. So all that will take care of how the colon acts. And if the colon is happy, the rectum will be happy. Sometimes there are other things that happen in the colon that also produce pain down here, ulcerations. Although Crohn's disease is more of a small intestine issue, we have had some Crohn's disease occur in the colon. It's very rare. You can have infections or parasites that also happen around the sigmoid and the cecum. There is something called rectal prolapse. It's when the rectum actually comes out. You don't have a hemorrhoid that comes out, you have the whole rectum come out. Usually associated with pinworm infections here and there, more in the city, but I think I saw one in the last couple of years in the suburbs. People traveling from foreign countries can have these because of, number one, the travel from a foreign country, just a plane ride for several hours into coming back into the U.S., the changes in food and the food consistency and fiber consistency, and also a shift in time and stress. Anybody that's going through a little bit of a detox will also have a lot of change in the speed and the poop that has to come out, and the consistency too. So that can always flare up an old hemorrhoid. When you have hemorrhoids that all heal up, you can actually, because a hemorrhoid is going to be, even if it's gone, it will become mostly scar tissue. Sometimes it is easy to come back. So people will know when they're misbehaving because they'll feel the old pain coming back. Whether they notice a little bit of irritation here or they start to notice that the stools become more narrow, it's because the hemorrhoid is starting to form and they're going to change in caliber size. So once you see problems with blood in your stool, like blood streaked stool, drops of blood in the toilet, especially as you get to an older age group, you can't just blame it on a hemorrhoid. You might have other things going on up above that have to be scoped. Nowadays, it's just better to have a total colonoscopy. That's where they actually knock you out. You have to get a prep so all the poop is out, and they send the scope all the way around to where the small intestine joins. That's around where the appendix is. So because it's such a long pathway, you have to have the GI people knock you out so you don't feel the crampiness of it. And you're better off having it when you're knocked out, believe me. So that's essentially what happens when you have hemorrhoids. That's usually how you take care of the average hemorrhoid. But if you're unsure, if it keeps on coming back, you really have to see a doctor.